I'm Wendy Roberts, and I'm the Senior Director of Administrative Services, and I'm also the Community Benefit Officer. And I've been here at Grande Hospital for 28 years. A Community Benefit Officer is the person in charge of the community benefit efforts at your hospital system. And so that is one of my roles, is to connect the community with the hospital and to determine what the needs are in our community, and then work with our community partners to accomplish those needs. The Community Benefit Subcommittee takes the vision that comes out of the Community Health Needs Assessment, and they create the work plan that we work on for the next 3 years following the needs assessment completion. And these folks reach out into the community, they leverage community partnerships, they're very passionate about causes in the community, and they help to connect things that one person might know about, but the others don't. And so it's a wonderful collaboration. Members of the Community Benefit Subcommittee also serve on other committees throughout Union County. And so what this does is helps to connect all of us, and so we're bringing the information that we know about the certain segments of the community that we work with. Ever since I first started in this job 28 years ago, I've worked on community benefit in some form. When I first started, it was just a list of our accomplishments and the groups that we worked with out in the community. We did a lot of support groups and things like that. We funded some community projects, but it was it wasn't as organized as it is now. It reminds me a little bit of a carnival game, the one where you would take the dart and throw it at the balloon to try to win a prize. And that's how community benefit was in our community. We had all of these different entities, all of these not-for-profits, all of these social service groups that were doing their own thing. And so, it was just trying to hit and make a little bit of impact. But since the Affordable Care Act, we now work a lot better with our community partners. Before 2009-2010, when the Affordable Care Act came into play and became a law, Grande Hospital had more flexibility in what we did with our community benefit. We would keep documentation of the support groups and the efforts that we partnered with entities in the community. But in 2009-2010, the Affordable Care Act came into play, and from that point on, we had more rules and regulations around community benefit. So we now have a very structured environment where we have to do a needs assessment, a community health needs assessment every 3 years. And we have to do an implementation strategy that talks about, what out of that needs assessment, what we have chosen, what are the top priorities, the top needs, unidentified community needs in our community. And so we take those, and then we develop a work plan from our implementation strategy. And so for the next 3 years, we work on those things. And we work with our community partners. Everything from law enforcement to our public health department, CHD, to our school districts, to Community Connection of Northeast Oregon. We also include churches from any denomination in our community. We invite anybody who wants to participate with us. And what we do is we work with the Hospital Council of Northwest Ohio. The last 9 years we've worked with them. They work with us to develop a survey, and it's a mail-out survey, about 130 questions. We have some of the questions that are core questions. They come from the CDC, and then we have questions that we can tailor to what we want to drill down in our community. And like I said, we've done this for 9 years now, and so we have a lot of history, and so we've had now some time where we've repeated the question or we've changed it just a little bit to get a little more information, so we're able to drill down even more. And we've had a very good return rate, around 40%, which is statistically valid. And so we have good feedback that's coming from our community, and it's all of our community, not just La Grande, it's Union, it's Elgin, it's North Powder, everything that makes up the 2,038 square miles that make up Union County. The The three unmet needs that Grande Hospital Community Benefit has identified to work on over the next 3 years are chronic disease prevention and wellness, mental and behavioral health, and social determinants of health. One of my proudest accomplishments the last few years with Community Benefit and our community partners in general is the establishment of the Eastern Oregon Community Resource Network. That is a network that covers Union, Baker, and Wallowa counties, and it came through from the west side of the state. It was a project that they had put into play that came to Chris Evans at DHS, and he presented that idea to myself and other partners in our community and asked if I thought that would work here in Union County. And I definitely did. He asked me to be a stakeholder in this project, and I've served on it since we started about a year ago in September. September of 2021 is when the EOCRN was officially born. The long-term impacts that I see of the EOCRN is connecting more people together. It impacts Union, Baker, and Wallowa counties, and so we have resources being shared amongst those 3 counties. The beauty of it for Grande Hospital, and one of the ways that we utilize it here, is our community health workers are able to take the needs of some of our patients, and they're able to put it into the EOCRN and have a specific request. One in particular that I know of personally is we had a homeless veteran that here in Union County that had broken his phone, and he has cell phone service through being a veteran, but he had no financial funding to be able to buy himself a new phone. And so that went out from one of our community health workers, and I picked that up as a member of the EOCRN personally, and I was able to go out and work with our community health worker to find a phone that matched the needs of that person, and we were able to buy that phone for that one person. That's kind of how the EOCRN works. So it's those matching up of those resources that is the beauty of the EOCRN. The background organization that supports it is Building Healthy Families out of Wallowa County. So that is the organization that you would contact if you were interested in becoming a member of the EOCRN. What I love most about Community Benefit is serving our community. It's part of what we have a responsibility to do as a not-for-profit hospital. But for me, it's seeing it actually work out in the community. We get to see what our efforts bring about. We get to see that people are served. We get to see that playground that we've put out in the community. Some of my favorite projects in Community Benefit over the years have been, like in 2009, I know that we helped fund the Friday Backpack program that is still going in our community. And that's something that helps kids who don't have food over the weekend when they're not in school. And so it provides them food. There's a lot of food insecurity in our communities, and it's just one way that Grande Hospital has helped work with our community. Some of the things that we're going to be working on here from Grande Hospital over the next year with regard to Community Benefit have to do with the First Tooth program. That's one of the programs that our children's clinic has instituted, where we work to get fluoride treatments to children. So it's not just in the dentist office that we're being able to do that, but we have providers, nurses trained in the clinics to be able to provide that service, because healthy teeth has a long-term benefit to your health. Another one of the things that we're going to be working on here at Grande Hospital is the CHARMS program. The CHARMS program is one of the gems that I feel we've supported in Community Benefit. The target population for the CHARMS program is moms who are using drugs and the program is dedicated to helping them to get off drugs. It's a huge community partnership with law enforcement, social service departments, Grande Hospital. We have our counselors, our community health workers. We have our labor and delivery staff that work on this program and work to support these moms. And that in turn helps our community because they're healthier families in our community that come out of the CHARMS program. And we've had so many successes with this program. Our labor and delivery staff have given presentations about our CHARMS program to other hospitals, so it's become a model that we're sharing with other communities because we're seeing success in this area. One of the things that's a need in our community is housing. And for me, Grande Hospital is not a place where we're going to build houses. That's not our role. We provide healthcare. We don't build houses. And so our piece in the community benefit arena is to support other places that are building houses. For instance, we might fund a playground. We might fund a dog park. We might fund, an activity wall or something like that to help support these community efforts for housing. That's how Grande Hospital puts a piece in, but we don't actually build the house. We add to it, we contribute to it. One of the things that we're going to be working on with our Grande Hospital community benefit over the next 3 years is expanding our outreach to the Marshallese population in our community. We identified a need a couple of years ago for interpretation for the Marshallese population. We didn't have a supply of interpreters that were available to help the Marshallese. So we identified here at Grande Hospital that we needed to grow our own Marshallese interpreter, and so we identified a person in the community, in the Marshallese community, that had a passion for helping her people. And Grande Hospital worked with Northeast Oregon Network to have this person become a certified Marshallese interpreter. So that helps to serve the Marshallese population in the community. But one of the things in the next 3 years that Grande Hospital is going to be doing is working with this individual to, she's also a community health worker, and so Grande Hospital through our community benefit is going to be funding some of her time to help the Marshallese community. So not just within the walls of Grande Hospital, but out in our community. One of the things about community benefit for me is connecting people in the community with resources. And that's been the biggest thing, like with the EOCRN. But an example of that I just had within the last couple of months is I had some folks from the community that came to talk to me, and they wanted to know about Grande Hospital's community benefit and how maybe they could leverage one of our community benefit grants, because they're trying to create a center to help people with mental and behavioral health issues. And they have some property and they have some resources that they're using out in the community. But they had no idea that Grande Hospital provided grants, that we did a community health needs assessment, that we have a work plan that we work through every 3 years. And they had no idea that the EOCRN was a thing. They had no idea that the EOCCO provided grants to maybe help them build or enhance their facility. So my one meeting with them opened their eyes to resources in the community, and then I was able to connect them to the EOCRN, and I was able to connect them to the EOCCO Community Action Committee. So as a whole, this group for mental and behavioral health would be served better because of those connections and those resources in the community. So that's one of my passions that I have for community benefit, is connecting those resources and helping the most vulnerable people in our community, because those are the people that need our help most.